So my experience of the early pregnancy unit. I went to the early pregnancy unit during COVID lockdown. So my experience might be a little bit different to if you go now, whilst we don't have those measures in place. When I was referred to the early pregnancy unit, I was phoned by one of the nurses on the ward who asked me to come into the early pregnancy unit. When I arrived, I went into a waiting room and there were some other patients in that waiting room. Not everybody was experiencing a pregnancy loss. There was somebody there who was very unwell with vomiting during pregnancy. I waited there for quite a long time, probably about 4 or 5 hours in total on that first trip. So I would advise bringing a phone, so you've got something for distraction, maybe a book, some snacks. Be prepared. It might not be a quick visit. If you're very, very unwell, you're more likely to be seen sooner and to spend less time waiting. I was then taken into a consultation room where a doctor asked me about my medical history and then also about my experiences with that pregnancy. So the symptoms I was experiencing that led me to go in on that day. I then also had some tests. So I had to give a urine sample. They took some bloods. And also I had several transvaginal scans while I was at the early pregnancy unit. So that is a little white wand that they put into your vagina with some gel on it. They put something that looks like a condom on first. And they did move it around in my vagina to try to see different angles and parts of my fallopian tubes. After I'd had those tests, I was sent back into the waiting room and I did wait again there for a bit. So it was probably about 2 or 3 hours before I was first seen, and then about another 2 hours after I was seen to find out the results and the treatment options. So I had my scan by a nurse, and I think I had to wait for a doctor to give me my results. I ended up going back onto the early pregnancy unit several times. So I think I probably went about 5 times before I was then admitted onto a ward which had 10 beds. Which was a bit of a sensory nightmare. So I'd recommend taking things like headphones, maybe sunglasses, things that can, make staying in hospital feel less overwhelming. And because I was due to have surgery, I actually wasn't allowed to eat or drink for almost 24 hours, but they did give me a drip into my hand. So I didn't feel thirsty because they kept on giving me fluids that way. I had surgery and went back onto that same ward, and I didn't have a very good experience. I did end up having several meltdowns while I was in hospital, and I did leave hospital against medical advice because I'd had a reaction to the perfume that some of the nurses were wearing. But overall, I think, it was really important that I went. And even though it wasn't great when I was there as an inpatient, it was a medical emergency and I did need to have that surgery. So I would really advise you, if you're having symptoms, if you've got bleeding or quite a lot of pain early in your pregnancy, I would definitely say to go.